Building a better Bay Area. Moving forward, finding solutions. This is ABC7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC7. We always ask experts your questions every day at 3 to get answers for you in real time. Today, we kick off Asian American and Pacific Islander Heritage Month with a look at how this commemoration came to be. We'll also share the amazing work of the APA Heritage Foundation, which is holding a big event this Wednesday. Also, how would you like your healthcare coverage to include fertility treatments? An East Bay state lawmaker has introduced a new bill to make that a broad reality here in California. Assemblywoman Buffy Wicks will be joining us. But first, COVID comeback. BA2 actually make that BA4, and BA5 are now causing new concerns globally. New York City returns to a higher risk tier, and the challenges of getting your hands on the COVID treatments that are supposed to be easy to get and plentiful. Joining us now to discuss the latest news is ABC7 special correspondent Dr. Alok Patel. Dr. Patel, great to have you on.
Kristen, good to be here. Happy Monday.
Let's see if it's a happy Monday. Let's talk about what's going on here. What's happening in New York City? Not too happy there. That warrants this move today to the medium risk alert level.
And this is, I actually am happy that we're discussing a increase in the risk level without yet the matching increase in hospitalizations, because as the mayor was saying, like, we need to get ahead of this. We need to have more preventative discussions so that we're not reacting to a crisis such as overflowing hospitals. Now, I have not seen yet any changes in the recommendations. I'm sorry, not any changes in mandates regarding vaccines or masks, but there is the discussion that people in New York City should still be wearing a mask while indoors. So at the very least, when we start talking about moving forward in individual risk, it's important that we still keep stressing to people that the pandemic is here, cases are rising in a city like New York, and we give out those recommendations to protect yourself, which is why it's important they're having this conversation earlier.
Right. But in this case, it doesn't appear to be just cases. I think they're also saying hospitalizations and COVID-related ICU beds are also up. So, I mean, that, leads people to say, hey, what's going on? Because I thought the virus is now just causing mild cases.
It is, by and large, still causing mild cases, Kristen, but the reality is if you have more than 40,000, at least reported positive cases a day, even if the percentage of those that are severe getting hospitalized is a lot lower, you're still going to see that increase. And in a place as dense as New York City, it's not surprising that they're seeing an increase in hospitalizations. You have to compile this on the fact that we are suspecting that protection from the vaccines could wane after 4 to 6 months for those very vulnerable populations, on top of more transmissible variants, with us not having as high of a booster number as we want to. So all this put together is probably the reason why that this conversation is happening in New York City. It's been increased to an increased level, and also why somebody like Dr. Birx issued a warning today for southern states moving forward. We just are not out of the pandemic yet, and the risk is still all around us.
Right. Could it happen here in the Bay Area?
It could theoretically happen here in the Bay Area. There's one thing that I'm very proud of about our fellow Bay Areans, if that's a phrase, is people here tend to be very responsible with respect to wearing masks, being vaccinated, and taking care of one another. And so we definitely have the potential for the risk here, but we have a lot more adherence to these measures. And Kristen, one thing that I want to stress also that happened in New York City is the mayor also said that there is no intention to shut businesses down, to close schools, or to go into lockdown. And that is a very important talking point because of so many people who are against pandemic restrictions accusing public health officials of wanting to lock everything down. That is not the goal. The goal is to keep moving forward, but to still take prevention seriously.
That's right. Not going to shut down. Didn't even say they would bring the mask mandate back, but they're opening up the discussion with a recognition that cases are going up. All right. I know that as you look at social media, sometimes some tweets get to you and you feel this need to correct them because you don't want people to get the wrong idea because it's their health. So you got some, what should we call them? Terrible tweets, terrifying tweets? I don't know.
Actually, I flipped the script today. These are just tweets that I want to use as talking points. They aren't necessarily terrible tweets. We did that in the past. These are just important talking point tweets that I think we could share with people. And talkable tweets. Okay. Brandable. Beautiful.
Okay. So we got them. Let's roll.
I think this is a very important one to just kind of give us a reality check. This is from Dr. Lori Garrett. As the far more contagious newer COVID strains, BA.2121, BA.2, 3, 4, and 5 co-circulate in New York City, I'm surrounded by fully vaccinated friends and colleagues down with COVID. One is sure she caught it on a flight from SF to JFK on Thursday. Be careful, friends. This is a loaded tweet. I think the important things that this one highlights is that there are new subvariants off of Omicron, such as BN4 and 5, which is suspected to be causing a rise in cases and hospitalizations in South Africa. Why does this matter for everyone else? Because South Africa had a high amount of natural immunity from the Omicron surge. And scientists are worried that natural immunity is not going to cut it when it comes to these new variants, which is why here we can't rest on the fact that natural immunity is alone for some populations. We have to make sure everyone out there is not only getting vaccinated and boosted, but they're taking it seriously. I just flew, Kristen, to Phoenix this past weekend, and more than half the flight was not wearing a mask, including people who were coughing and sneezing. Not cool.
I will say, I talked to a friend who currently has COVID, and she is thinking that the fact that she was wearing a mask on the plane when she probably already had COVID probably prevented her from giving it to people around her. So people often think about it as, oh, I need protection or I don't need protection. But really, you might need protection from the guy next to you. And you might want to thank him for wearing his mask, you know?
Absolutely. It's a community mindset. And they say one-way masking. And it's just this is the type of masking we've been doing in healthcare settings for years. When we wear a well-fitting mask with high filtration around a patient who's not wearing a mask, who may have an airborne virus such as measles or tuberculosis, and it keeps us protected.
All right. You got any more tweets to share before we move on?
I do. I have two more, and I can be rapid with them. Here's a very important one. This one is going viral for good reason. Test to treat needs to be fixed ASAP. No one should have to navigate this kind of maze to get Paxlovid or any other early therapeutic. Time is always of the essence, even on weekends. Kristen, I want people to look up this tweet thread by Diana Zicklin-Barrett and look to the steps she had to go through to get her high-risk teenager Paxlovid, including going to multiple CVSs, going to an urgent care, pushing to get a prescription. It was a huge, arduous process. She recognizes also that she is privileged and has the knowledge. What does this mean for people out there who need Paxlovid, but maybe don't have the time, the resources, and the knowledge to go and advocate for themselves? It's a very alarming situation.
I saw that, and I was actually going to ask you about Paxlovid because the whole test to treat means you go to the pharmacy, you test positive, the pharmacist right there gives you Paxlovid or another antiviral, but that is not actually what's happening. And not only can some people not get it at all from the pharmacy, some people cannot get their doctor to prescribe it to them at a time when the Biden administration is saying, we want more doctors to prescribe it, we do have the supply. So why are these things not aligning?
There's a big disconnect right now between the promises and the availability of Paxlovid with what's actually happening in certain neighborhoods. And this really needs to be addressed because as this tweet thread outlined, what we're hearing anecdotally is that a lot of pharmacies, maybe they're closing early. Perhaps the pharmacists say they can't fill the prescription without a doctor's note, when in reality, some pharmacists are saying that you can get diagnosed right here and get the prescription right here. There is a disconnect. This urgent care this person went to, they were told the doctor wasn't able to prescribe Paxlovid. When she pushed and finally got the appointment, the doctor said, yes, I can prescribe it. So there is so much miscommunication in terms of what's actually available, and that absolutely needs to be cleared up.
Yeah, because you should ideally take it within the first 5 days, right, of symptoms. But I wanted to ask you a couple more things about Paxlovid, which is there any evidence that it could also help prevent long COVID or get rid of your long COVID symptoms?
You know, I haven't read yet, Kristen, that it's going to be able to prevent long COVID. I can make an educated guess and say that it's possible if you reduce that viral load, if you reduce the virus's ability to replicate in your body. It makes sense to me that we'll find clear data that this prevents or at least reduces your risk of long COVID in the same way that vaccination will as well. If you're reducing the ability for COVID to replicate and infect your body, you're probably going to reduce the risk of downstream effects. That's an important thing to follow. And anyone out there should also remember that long COVID is very real, with studies saying that it's affecting between 10 to 30% of people, even those who may get an asymptomatic or mild initial infection.
Okay. Also, I'm wondering about, I'm hearing that some people on Paxlovid improve while they're on it, but then after they're done with the, I think, 5 days or whatever the course, they get worse again. Is there any explanation for this?
As of right now, I have not seen a clear explanation, fortunately, based on anecdotal reports and what we've read about.
It's very rare, but it has
very
happened.
rare. The average is about 2%. And I think that's important for two reasons. Number one, just if it's rare, it's still being taken seriously. Pfizer put out a statement about this. There's going to be new research about if there's going to be a change in guidelines for people who may be high risk. And people should understand and feel reassured by the fact that even though it's rare, it's being taken seriously. And also, this does not mean that Paxlovid doesn't work. This does not mean that people out there should say, "Oh my gosh, once again we have missed the boat and we have a treatment that's not going to actually work." Paxlovid still is very effective at preventing severe hospitalizations. We just have to really sit and look to see what the 2%. What does that population looks like? What does this actually mean for those? And do you get treated again, for example?
All right, we're almost out of time, but I want to ask you, given these recommendations now from some cities, from some companies, from some universities to mask in indoor settings, what are you currently doing? Have you made any changes?
I currently, personally, am still masking in an indoor setting. There's no question if I'm masking, if it's a crowded indoor setting. If I'm going to the grocery store, if I'm going to the airport, I'm wearing a mask. I'm wearing a well-fitting KN95 mask or an N95 mask, depending on the situation. And Kristen, that's not only because I don't want to get long COVID. I do not want to pass it on to Alora, who just turned 1, who is still not eligible for a vaccine because we seem to be going back and forth on when that's going to be available for children under 5. Parents out there, I feel your frustration. But that is why I continue to mask.
All right, June, right? June for kids under 5. Right?
That is when the independent advisory committee is going to meet. We haven't heard an exact date, and hopefully, if all the data looks good, it'll be approved shortly thereafter. But Kristen, this is after parents were already told early 2022, April, May, and now it's pushed to June. So a lot of parents out there that are saying, "Hey, what about us?"
For sure. Dr. Alok Patel, thank you so much. Always great talking with you.
Kristen, thank you.
Coming up next, May is Asian American and Pacific Islander Heritage Month. We'll talk about San Francisco's annual celebration and the various upcoming events. Be right back. All right, folks, be right back. May is Asian American and Pacific Islander Heritage Month. ABC7 is proud to celebrate with our community partner, the APA Heritage Foundation. We're excited to have on the show today the president of the organization, Claudine Chang. Hi, Claudine. Thanks for joining us.
Hi, Kristen. Thank you for having us. Thank you for having me.
It's definitely a pleasure. I mean, how did AAPI Heritage Month, I want to start with this, in the month of May, how did that come about? What's the history there?
In the mid-1970s, a number of national organizations were lobbying Congress to pass a bill to celebrate the history and the contributions of Asian Americans in the country. They were inspired by, at the time, the Black History Month celebration and the celebration of National Hispanic Week. So a number of national organizations put together a national campaign and trying to get that passed. Actually, the AAPI month is a federal legislation signed into law by the President of the United States.
Yeah, it expanded into a whole month, which is fantastic. And APA Heritage Foundation, your group, how was that created and what is your mission?
Back in 2005, at the time, this just occurred to me that with the demographics of Asian Americans in San Francisco, that somehow we do not have a coordinated citywide celebration. So I brought that to the attention of then Mayor Gavin Newsom, who said that, oh, it's a great idea, let's do that. So that's how it got started. And so the APA Heritage Foundation is a nonprofit that was established in 2009 to every year to fundraise and to identify resources to keep this community celebration going.
So your celebration is this Wednesday, right? Can you tell us a little bit about it, the theme, the significance, how you can attend?
Well, Wednesday, May 4th is our signature event. It's the APA Heritage Awards. We take this opportunity to, of course, recognize role models in our community. The theme this year is forging community bonds. We hope that through the whole month of programs that we can create opportunities for communities to get to know each other. I think the idea of the bonding is very important, especially at this time, because of what we went through the last 2 years with the pandemic, with anti-Asian hate. And actually, it's not just for the API community, it's just really including everybody in San Francisco. We really want to have an opportunity, create programs that welcome everybody to be part of it.
Yeah, in fact, your official celebration guide is online, right? We do invite everybody to check it out. Lots of great events. I want to ask you, you point out a good and I think an important issue, which is we've been through a lot collectively, but certainly the Asian American community, there's been hate, as you mentioned. So, but given everything overall, is this a difficult, challenging time to be Asian American, or is it also a promising time? Are there rays of light?
It is challenging because we are seeing history repeating itself. The history of communities feeling excluded, the history of communities feeling, that they are not treated equitably, fairly, and so I think that's the challenge that we have been having at all time. I mean, at all times that history repeating itself. But I think that through the challenges, as we all know, there are opportunities, and I think that many people have observed a silver lining in this last year too, that communities are coming together, communities are speaking up, and we really make a concerted effort to not only within the diverse API community, but to get to know bring in all the communities of color together. Because in order for this to work, I think we all need to basically really support each other.
That is a great point. Claudine Chang, president of the APA Heritage Foundation. I know you're a volunteer-driven group, and I know you're always looking for volunteers, whether you're interested in attending this Wednesday, registering, or just finding out how you can help. Go to apasf.org, right? Thank you, Claudine.
Bye. Thank you.
Take care. All right, coming up next, there's a huge lack of insurance coverage for fertility services in the U.S., and an East Bay state lawmaker is now trying to change that in California. We'll be right back.
Any commercial break?
All right, we'll be right back. According to the CDC, infertility is a common struggle. About 1 in 5 couples in which the woman is in her 30s have trouble conceiving. And even in couples where the woman is younger than 30, 1 in 8 have a hard time getting pregnant. A bill to expand insurance coverage of fertility treatments is making its way through Sacramento now. Its author is East Bay Assemblywoman Buffy Wicks, who is here now to talk with us about AB 2029. Thank you so much for joining us today.
Thank you so much for having me.
Assemblywoman Wicks, your bill would require that any health plan or disability insurance that covers hospital, medical, or surgical expenses also cover in vitro fertilization. I didn't realize that wasn't the norm already when we talk about coverage for fertility treatments.
Yeah, it's not a requirement. Some employers require it, some insurances do provide it, but it's not the norm across the state of California. And unfortunately, higher income earners have the ability to afford IVF treatment and fertility treatment, but low-income folks don't. And it's a real equity issue. It also is an equity issue in terms of LGBTQ couples who often aren't covered as well. And so my bill would really seek to level the playing field here.
In that, who is eligible? Name if there are any limits based on sex, gender, marital status, sexual orientation. No limits. Anyone?
Well, yeah. Well, right now, often LGBTQ couples are not covered, and this bill would require that they are covered, indeed. Okay. And again, we've taken some amendments to narrow the scope a little bit because we've had opposition on this bill in years past because of the cost. But what we know is that if you spread the cost across everyone, it's actually a very small amount of money to ensure that this equity issue is fundamentally addressed. You know, we know that this is a recognized medical condition and that there are widely accepted standards for diagnosis and treatment. Mm-hmm. But unfortunately, insurance plans in California are not required to cover fertility services. And often, as I mentioned, they discriminate against LGBTQ couples.
How much does the treatment cost these days? Give me an idea.
Well, yeah, it depends on what you're seeking to do, but IVF, which is one of the more advanced procedures, can cost anywhere from $24,000 to $38,000 per cycle. And for some folks, it can mean multiple cycles. Mm-hmm. If you do IUI, that's anywhere of around $5,000. So it just depends on what the need is. And I'll tell you, you know, I'm a mom of 2 young girls. And my second daughter is a product of IVF. And so for me, this issue is very personal. Yeah. We were able to have her because I had the access and the resources to those medical treatments.
You are one of the lucky ones, right? And you want to make sure others also have that. Does your bill include exemptions to any organizations?
There are no exemptions. That's important for us that everyone has access. You know, and often what you'll hear from the opposition is the cost is so expensive to the employer. But what we've found in research, and it's not a research, it's independently verified.
Wait, so I'm sorry, does that mean if you're, let's say the employer is a religious organization, that is not an exemption?
There are no exemptions, correct.
Okay, thanks. Look, has any analysis been done in terms of how much, you talked about when you spread out the cost, right? But what is the aggregate cost in terms of total premiums paid by private employers for group insurance?
You know, we expect it to be very minimal every month, maybe $1 or $2 across the board. So we think it's very reasonable cost. And, you know, in 2021, Mercer did a survey of 450 employers nationwide and found that only 97% of the employers offering infertility coverage saw any kind of an increased medical cost. So we think the cost is very manageable. And I will say 13 states outside of California have already done this. So we're actually behind the times. And I know we like to think of ourselves as California goes, so goes the nation. Mm-hmm. But on this issue, we need to catch up.
But the insurance industry, obviously, some of them are very imposed as well, talking about how maybe the costs cannot be absorbed, or perhaps employers would have to raise their employee contributions, or maybe they wouldn't be able to cover something else. Are those concerns that you have?
Well, like I said, we've limited it to 3 cycles of IVF because we did want to address some of the concerns that were raised. But we view it as a true equity issue. We think low-income, middle-income folks who don't have the resources to pay for this should be afforded the opportunity to have children. We think LGBTQ couples should be able to have the opportunity to have children. So we think it's worth it. And we think that the cost is absorbed across such a wide number of people that it's a doable cost for folks.
Okay. congratulations on the bill passing out of an assembly, I think last week, right? So what is the next step?
Yeah, so it will go through the Appropriations Committee and then onto the floor of the Assembly in the next, 2 months or so, and then over to the Senate for votes there as well.
All right. Well, that is really, really good to know. So let me just ask you one more thing about this bill, and that is, who have you consulted with in writing this? I know you have the personal background. What are the doctors telling you?
Yeah, we've consulted with a number of organizations, healthcare organizations, Equality California. It's a big priority for them as well. Healthcare providers, it's in organizations that work, medical organizations that work within the fertility treatment space, who have all consulted on this bill. And we also continue to talk to the opposition. I want to create thoughtful policy that works for folks. I'm always happy to take amendments and meet with opposition. So we will continue those conversations as we move forward as well.
Assemblywoman Buffy Wicks, thank you so very much for talking with us today about your bill to cover fertility treatments for everyone here who needs it. Thank you. We'll be right back. All right, we'll be right back. Thank you so much for joining us on this interactive show, Getting Answers. Today we talk with Dr. Alok Patel about why Paxlovid is still too hard for COVID patients to get their hands on. We explored the genesis of Asian American Pacific Islander Heritage Month in May and a new state bill to make IVF covered here in California for more people. We'll be here every weekday at 3 on air and on live stream answering your questions. World News Tonight with David Muir is next, and I'll see you back here at 4.